talk about athlete's foot. Some of the chemical treatments, I never really like that. So let's talk about some of the traditional things, kind of everything old is new again. What's your favorites in terms of how to treat athlete's foot?
Well, first I like to get at the root of it, which is moisture. So number one is your feet need to be dry. That means your shoes need to be dry, and you need to dry between your feet after your shower. So the way to do that is, number one, drying your feet, making sure to get between the toes, the whole foot. If you have an infection, don't use the towel that you dried an infection on the rest of your body. You will inoculate yourself with that infection. Number two is just to keep it away using powder in your shoes. You can use natural powders. Cornstarch works. Baking soda works. Your favorite antifungal powder works. You can put a little in your shoes and a little on your feet. And letting your shoes dry out between uses. So varying your shoes. If your shoes are moist, if it was a humid day or a rainy day, leave them out, let them dry. If you have sun, that's great. If not, make sure you put some baking soda in them. Leave them out, pull the insole out, let the whole shoe dry. If it's a sneaker, pull the insole out. If there's an odor, wash the sneaker.
So should people really then have multiple pairs of sneakers that they rotate?
They should if they can. And if the sneaker is old and smells, just get rid of it.
How about socks?
The wicking socks are great. They keep the moisture away. Make sure your socks are clean. Don't share socks.
I always say never wear cotton socks. Big blisters, the whole bit.
Whatever's comfortable. Diabetic socks work very well for people, but the wick socks work very well to keep moisture away, as long as the sock is comfortable and not too tight.
All right, so now how do we treat it?
We can treat it either with natural remedies. If you have a frank infection, itching, blisters, you see redness, or maybe a circular area on the foot, I would go to the drugstore first and try Lamisil, Lotrimin, Miconazole, which is also known as Monostat. You use it twice a day for a week to 2 weeks, depending on how bad the infection is.
And those are just those traditional antifungal, anti-yeast. Monostat is always the woman's drug.
And it works very well for fungus plus yeast, which is normally in a moist area, which would be the foot, which inside the shoe you have darkness, moisture. So these things grow in there. But these used to be only prescription treatments. Now getting them at the drugstore for inexpensive amounts is fine. It works.
Okay. And how about some of the good old-fashioned things? Because I like those.
Yeah,
I like those. I have them in the cabinet.
Home remedies are great. Number one, keeping feet dry using soaks. Domeboro soaks.
What's Domeboro?
Domeboro is a drying agent available at the drugstore over the counter, and it dries the feet, so it keeps things from growing. Vinegar soaks, using something like 2 garlic cloves and a little bit of rubbing alcohol in water will kill off any bacteria, fungus, and also deodorize. Lemon juice in water. Any of these things will help. But if you
hot water, cold water?
Comfortable water. Never too hot, never too cold. It's not a good idea for the body. And especially if you can't feel very well, make sure you test your water with your elbow so you don't burn yourself or freeze yourself.
And then how long would you soak for?
You can soak comfortably for 20 minutes. If you have an infection, you can soak safely for an hour. As long as if it feels good, less itchy, less painful, you're good. 10 minutes will usually help.
And is soak something someone should do on an ongoing basis, just even prophylactically to prevent it?
Soaks can be used for so many things to prevent. It helps with muscle strains. If you use a drying soak, like the Domeboro soak or vinegar, you can use it regularly if you are subject to athlete's foot or any of those things. If your feet are extra sweaty, which is a normal thing, you can also soak in tea, regular black tea, diluted. The tannic acid dries you.
Awesome. Okay. And how about, real quickly, any essential oils?
The essential oils will help. Oh, they help. Eucalyptus, lavender, oil of oregano, tea tree oil, a known antifungal. They will help. If everything works for different people, you can try it twice a day. If it works, keep using it. It won't hurt and it will only help.
And do you dilute it? Do you put it straight on, or do you dilute it a little with some straight on?
I put
just
it
a couple
straight
drops.
on. Yeah.
Okay. All right. Great advice. Thanks, Johanna.
You're welcome.
Thanks for watching. If you like what you saw with Dr. Johanna Youner, we have more videos at bottomlineinc.com. And do the social thing. Share this. Let your friends know. We've got so much great information. Come on along.